We're live. I'm behind the camera. I'm going to join you in a second, but we wanted to give you guys a little window into what's new in our practice, right?
Yeah.
And we're in front of this lovely device that we love so much. We've got two of.
Yeah.
So this is the M-Phase platform, but onto both of them, we've actually added a new device called Exion. So we kind of wanted to talk about that.
Yes.
And it's got two different forms. So it's got a sort of an energy that we call microablative. It's going to affect sort of the superficial aspect of the skin, and then microneedling radiofrequency, which I really want to drill down into because I feel like there's a lot of chatter out in social media about it either being painful or destructive, and I really want to talk about sort of what differentiates Exion. So maybe we can start a little bit about sort of the first platform, kind of your experience, because we actually were one of the sites to sort of first provide some clinical experience as the microablative platform was debuted.
Absolutely. So Exion came out with a device called, or a modality called Exion Clear, which is considered a microablative radiofrequency treatment. It is a superficial treatment, so it's penetrating, more superficial in the skin to help with, as the title entails, clearing the skin. So it helps with like reds, browns, ruddiness, pigmentation. It helps with, kind of tightening pores, superficial fine lines, and a really nice, just kind of like a skin buff. So we were doing these treatments as part of a clinical trial, and I actually included my friends in this treatment, to have them try it. And they loved it. All the patients that we treated, their skin was more radiant. It helped with, just pigmentation that had been there for years. Everyone had a really nice radiant glow afterwards. And so it's a really nice, if you're trying to just clean up some existing issues, or, I could see it having a place if you wanted like a glow up before an event or something where you just feel really fresh. The recovery time was very easy, very minimal, as well as the, comfort. It was very tolerable for patients. Everyone just used topical numbing cream. It felt a little bit, you can feel a little bit of like a prick sensation or just a light dull, sensation of like something sharp, but in general, just a little warmth after the procedure, and it was very, very comfortable. So we're so excited to have that on as part of the, modalities that we offer.
Yeah. And, I think the nice thing about radiofrequency is that it's relatively color blind within parameters. I mean, we want to be really responsible as providers, looking at skin type, but it's one of those things that being relatively colorblind, we can use not only on our lighter skin tones, but we can use on our staff and our patients that are richer skin tones as well. So Latino, African American, Indian skin types, Middle Eastern, all of those can benefit from this particular treatment. And what I think is so interesting is BTL has really built a platform off of radiofrequency, and they had a little niche that was missing, which was sort of skin quality. And so they are very smart in their scientific approach, and I think their clinical approach to skin and other tissues, and really wanted to develop something that we could affect the skin envelope. And so I think it's very interesting, the microablative technique. It makes sense that it would build a little collagen, that it would help with underlying pigmentation, especially that ruddy stuff that's sort of difficult to pick up sometimes with even repeated things like IPL treatments or, Clear and Brilliant. But to get redness, I think, is really interesting with radiofrequency. And we don't exactly understand the mechanism of action, but I think probably what's happening is the radiofrequency with tissue repair is making the skin envelope and the skin sort of milieu healthier. And if we're down-regulating some of the inflammation and making skin healthier, inflammation promotes redness. It promotes what we call vasodilation, so the vessels expanding, becoming larger in size, and that causes coloration over time. So I think that's incredibly innovative, that in clinical trials and in clinical experience, that was something that was seen. That was sort of surprising, to be honest with you. Like, if you had asked me before this was in clinical practice, is this something that would affect redness? I would say no. Typically, we need like a laser or IPL to target a chromophore hemoglobin, which is, part of a red blood cell, which is in the blood vessel, and we heat that up and cause selective destruction. But this is something that I think is a really unique modality and sort of making overall skin health sort of healthier. So tell me about series of treatments. Tell me about like maintenance with this.
Absolutely. So we're treating typically about 4 weeks apart. The recovery time is maybe a day or two for the face. So off the face, it takes a little bit longer, maybe 3 to 4 days. And typically we're doing a series of 3. Once you're done with your series, the maintenance is usually about every 6 to 12 months, just based on your results and what you have going on in life. But usually, I would say like a 6-month cadence is typical. And it's been wonderful. I mean, like I said, patients, the glow is not something that, sometimes with devices you'll have this glow right after you do something and you just feel really good for like a few weeks. But I saw one of the patients, a friend of mine, I saw her at an event, at a party, and she was still glowing, and it's been like 4 months, I think, since she's had anything done, and she's like, well, look at me, look at my face, it just looks so good. So it's definitely been a really nice, add-on to what we already have to offer here, and I think there's a really nice space for it.
Yeah. So we'll switch kind of from the microablative, which really primary to its sort of treatment effect is brown, red, and a little bit of glow up, like we were talking about, minimal downtime, and really just treating sort of more surface skin, to radiofrequency and microneedling, which I think gets a lot of play. This is, like our 4th and 5th microneedling radiofrequency device that we have here in the practice. We have just straight up microneedling. And so I think some of the advantage of delivering radiofrequency through the needles is we deliver bulk heat energy to the skin. So whether we're targeting the skin or whether we're purposely targeting deeper tissues, we can have a biological effect on the tissue layer that we're targeting. And I think, sometimes I see sort of disturbing posts or comments about either radiofrequency microneedling being uncomfortable, which I do think there are platforms. We've got a couple here that I almost, I like my patients to be comfortable and I like them to like us. And we do have a couple of devices that I think are challenging in terms of comfort measures. And, there are some that are incredibly popular. Like people will ask us about things like Morpheus 8. It works. You need to do a series of treatments, but oftentimes patients have had it and they do it once and it's so uncomfortable they really don't want to repeat it, or they bear through it and are just like, we don't want to see that. We want to see procedures that are easily tolerable, that actually have great safety margins and provide clinical results that we're really happy with. So I want you, because you do such a beautiful job, I think, explaining some of the science. Let's talk about microneedling and radiofrequency on the Exion platform and what makes it different.
Absolutely. So as Dr. Palm said, I know a lot of you out there have probably had radiofrequency microneedling treatments. I personally have. I know I can speak to how they felt. I've also worked with different devices as well, and because the energy is going, it has to go deep into the tissue, it can be uncomfortable for some areas and some people. This technology is unique in that it uses AI technology, so it's kind of considered like an advanced device compared to the older school of radiofrequency microneedling devices that are already on the market. Part of what that AI technology does is it allows the pulse to be delivered in a more appropriate way. So it kind of controls the pulse duration and how the pulse is delivered in real time for that area of tissue that it's treating. So the energy, and I think that really has an impact on how it feels for the patient. You're still able to penetrate the depths that you need to, so it's not a superficial treatment. It can go, the needles themselves penetrate up to 4 millimeters deep. Anything beyond that, you are going to get some effect on fat remodeling, and you want to have that as a goal. If you're using that depth, that needs to be a goal of yours. Some areas where we might want that as a goal is like, maybe submental tissue, body areas where we want to get some of those little stubborn pockets of fat. And for those areas, if, for example, on the body, you want to go even deeper, the device has a feature called extended mode that can cause improved thermal damage even up to 8 millimeters deep. So it can penetrate and get this damage of the tissue deeper, but more comfortably, because as you can imagine, if needles are penetrating 7, 8 millimeters deep, like you will feel that it is uncomfortable, especially if there's heat transmitting out of the tip. For the needles, they have heat that diffusely transmit if it's a non-insulated tip, or if it's insulated, the needles penetrate into the skin and the heat comes out of that tip. And so it's all about how that energy is delivered that makes an impact on the comfort level.
Yeah, and I think so many of these devices are effective, but is it comfortable?
Yeah.
I mean, we have a radiofrequency microneedling device that goes quite deep, and it has insulated needles, so it just emits energy from the tip, but incredibly uncomfortable. So, comfort measures I've had to use, strong topical numbing, facial blocks, sometimes medication, to make patients comfortable, anti-pain relaxation medications to help them out with that. And that's just a lot. And so, I think I'm always looking for technology that offers clinical improvement, is innovative, but is comfortable for patients, and it's a pleasure to do rather than feeling like you're going to torture your device. I've been at meetings where people who have used other microneedling radiofrequency platforms that can be uncomfortable and you need to do same measures have even to mess the whole face. And that just, telling patients they're going to have a swollen face for 5 days is not, ideally what we'd like, especially if we're trying to minimize their level of downtime. So I really love that. Our goal with skin tightening is we're doing more superficial treatments on the face. In general, we don't want to target fat. Fat is good. It's really in areas such as the jowls and the submentum that we would target sort of more deeply. And then obviously with body applications, if we're not just doing skin tissue tightening, but wanting to affect the fat pocket a little bit, I think it offers that versatility, but truly comfortable. So like when you've been administering the treatments, what do patients tell you the treatment feels like?
So they can feel, based on the depth of the needle, they can feel a little pinprick feeling, but in general it just feels like a little sharp, sensation and maybe some mild heat, and that's really it. And I would say 100% of the patients have been doing this treatment with just topical numbing cream. Nobody has asked for more than that. Nobody has said they needed more than that. Average pain scales are like a 2, 3 out of 10, depending on how deep I have the needles in that moment. And I would also add that recovery time has been very, very short with this treatment, if any. It's very mild. Because of the AI technology, you only need to do one pass with this. So, if there is an area where it is a little bit uncomfortable, you don't need to go over it again and again with other devices that is recommended. And I think that also might attribute to the recovery, because you're not causing as much trauma to the tissue. And really, people look fine the next day. They might have a little bit of swelling or inflammation, but it's very minimal pink. So that's been a huge, I've been very happy with that as well.
And maybe both for the microablatives,
Yeah.
so the lighter treatment, and the microneedling radiofrequency when we're actually penetrating the skin. Talk a little bit about like aftercare and
absolutely.
And what cream we'd like to use.
So this has been the cream that I've been having everyone use, and if you guys are familiar with any of our devices here, we just lather you in this. So you be honest, it is wonderful. I know Dr. Palm brought this in about a year ago because it came in right as I was joining the practice. And she was just telling, everyone, all my patients are calling me, telling me how much faster they're healing. This is made by a company called Rejuvenation. We carry their skin line, and they're wonderful products. This is designed specifically it's called CMT cream for post-chemical, mechanical, and thermal injury. So anything, laser related, anything that's causing any sort of trauma, injury to the skin, we apply this post-procedure. It's very well tolerated, so really anyone can use it. And we've noticed it improved discomfort post-procedure. So if you have any of that little burn feeling that you're laying there and going, oh my gosh, how long is this going to last? We add a layer of this, and it calms that down pretty quickly. It also is used at home. When we send you home with a bottle, you use it, as you're recovering, and it shortens the recovery time for patients. So this is what we use on everyone, especially the first 24 hours. We like to keep things very clean and minimal, decrease any risk of any reactions or irritation, as you're healing. But this has been very well tolerated.
Yeah. So, I just love that. Again, that idea of just getting patients back to daily life a little bit more quickly. And again, that idea of just, okay, we found a device that's more comfortable. That's microneedling radiofrequency, but also, that little bit of tingly, sunburny feel afterwards, extinguishing that faster.
Yeah.
Really, I think has been helpful with the CMT cream. And so we are in March. We're going to do body boot camp. We're going to start talking about that, but we thought we'd give you a little preview. We're actually going to feature Exion because I think, I like the skin cycle a little bit, and something that I think is really helpful is doing something like what we talked about. We often will combine the ablative with the radio frequency, so we're kind of getting a full package of coloration and skin texture and tightening. But we'll often cycle it with things like IPL resurfix.
Yeah, absolutely. And I think that really meets a nice goal for patients if they want to work on, kind of working on skin texture, pigmentation, but also get that tightening benefit. I've had a lot of patients that are starting to rotate those procedures. Our IPL resurfix is actually on special this month, and because it's such a gloomy time of year, it's a really good time to consider doing those types of treatments because they do have sun precautions. You have to make sure that you're not too tan or going to be out in the sun. It's a really great treatment combination for like pigmentation and texture. So we do very often. IPL is really good for reds and for browns and kind of that vascularity to the skin, any sort of sunspots, and resurfix is a really mild resurfacing treatment that helps with skin texture. And so cycling the two, I think, has been really fun for patients because you're able to tackle different things, but the downtime is really easy from both of them.
Yeah, and with IPL resurfix, you can put makeup on right afterwards. We do the CMT first. Obviously, want to be careful about sun exposure and using sun protection, but I think such a nice thing while we're in winter weather. Today's a rainy day. like this is nice to be sort of thinking ahead so that we've got summer glowy skin, you know, a little bit of prevention and active treatment, you know, in the months leading up to warmer skin months, I think is really lovely. So call us if you look on our Instagram handles, San Diego Injector, Dr. Melanie Palm. You'll see we've posted that special. It's a really wonderful offering this time of year, and something that we rarely do.
Yeah.
So I think that's really lovely, and it's another one of those machines. It's so popular. We've got 2 of them. So you know, and call us for a consultation. Both Julia Jowett and Stephanie Williams, our 2 PAs, are so knowledgeable on this offering. It's really lovely. I see a ton of it on your all schedules, so it's been a popular offering this month. But if you have questions, if you'd like to schedule a consultation so that Julia or Stephanie can just go over your skin concerns and needs, it doesn't have to just be for this IPL resurfix. Feel free to do that. Our phone number is 858-792-7546. And then you're certainly welcome to interact with our website, which is artofskinmd.com. So just in the last couple seconds, I don't know if there was anything that you wanted to cover.
I just second that. I mean, I think I love getting to talk to you guys and meeting everyone, and so it's fun to just come in and chat about plans, and always feel comfortable doing that. If you want to set up a consultation, that's what Stephanie and I are here to talk about. And if you are a good candidate for this procedure, sometimes, you know, a patient comes in with one thing in mind, and we're able to put together these creative plans that you would not be able to put together on your own just from researching different things. And it might involve face and radiofrequency, you know, you never know what we're going to suggest. So I think it's great to come in and just chat.
Yeah, there's just so much information, and I think, how do you navigate as a consumer and as a patient some of the cosmetic procedures that we do? I think it really comes from having the right person in front of you, because that's I can't imagine, like, I have the luxury of being a dermatologist, and we do a lot of great science and a lot of studies, so I think we can sift through what's the pseudoscience and what's really, you know, excellent, and what's maybe sort of more mediocre, but that must be just incredibly intimidating, and especially with how things are sort of fed to us. So I think having a trusted partner that you can work with, that can talk about skincare, that can talk about devices, that can talk about injectables, you know, or chemical peels, you know, whatever the concern is. You need someone like that to be able to give you a knowledge base, to give you a treatment plan that makes sense, that's going to be successful both at home and in the office. So until next time, we'll do another Lunch and Learn. We wish you guys a great Galentine's and great Valentine's Day. And then let us know if you have any questions, but just wanted to give you a little info on the Exion. We'll see you guys next time.
Bye.